Okay, so this video is not all that recent. However, it was just towards the tail end of July. This is a video of Ben Shapiro absolutely putting on the worst. I shit you not, this is quite possibly the worst Ben Shapiro video I've ever seen in my entire life because it's riddled with lies, it's riddled with misinformation, it's riddled with these false ideas, and man, is it going to be a cringe fest. It is about Bernie Sanders. Now, for the context, of course, so there was a Mercatus, is what I think it's called. It's like some Koch brother funded think tank. So, but they did a study on Medicare for all, and it said that $32.6 trillion would be the cost over 10 years. Now, this would actually save $2 trillion over 10 years. That's the crazy part. So we'd be able to cover every single person in the United States, and on top of that, save total money spent on healthcare. And this is coming from a Koch brother funded study. So, I mean, if you're a conservative, you probably want to believe it, or if you're really anybody, because this isn't, the Our Revolution group coming out with the study. That's not what this is. This is directly from, a Koch brothers think tank saying that, hey, this is going to save $2 trillion over 10 years. Whoa. Are you trying to tell me that we're going to save money? Oh, how are you going to pay for it? It actually saves money on its own. So that a question on its own is a false premise in the beginning because it lies upon the idea of, we're going to be spending more. Nope. We are going to save a ton of money, $2 trillion over 10 years. And as Ben Shapiro is going to say here, it looks like the Our Revolution guys, or Bernie Sanders campaign, I should say, had came out and said that there was some program that they removed, so that would bring it down to $29 trillion, which would be even more savings. That would be $5 trillion in savings, which is savings is a good thing. So get ready for this. Buckle your seatbelts, put on your hazmat suits, because this cringe is literally over 9,000.
The other prong obviously has to be the insanity of the left and why these people should never be in charge of anything. The latest reason is because of this. There's a new study out today with regard to Medicare for all. Okay, so this has been the call from insane nut job Bernie Sanders. So Bernie Sanders, when he is not stuffing his face with pudding, believes that we ought to have Medicare for all. Now, Medicare is basically a blanket coverage for people who are old, but he wants that now applied to everyone. He essentially wants a government nationalized healthcare system. He says that this will pay for everything. It'll pay for itself. Whenever he is asked, people will ask him, so how do you pay for this, Bernie? He says, that's not important. What's important is that Europe finds a way to pay for all of this. And Europe has fantastic healthcare. Okay, first of all, Europe has 65% tax rates. These healthcare systems are bankrupting countries. And the fact is that they've had cutbacks in a lot of these areas. They've had to bring in immigrants to simply staff the medical profession in places like the National Health Service in Great Britain. These are all much smaller countries, too. I mean, when he talks about Norway or Denmark, these are places that have a population less than the population of LA County alone, and homogenous and engaged in the same culture. And, it's a lot. Let's put it this way. It's not easy to scale a nationalized healthcare system to a system of 300, just on an effectiveness level. Forget about the fact that it is an invasion of people's rights and that it's not my job to pay for your healthcare because your healthcare is yours. Right? It's my job to pay for my healthcare, my kids' healthcare, my family's healthcare. It's my job to help out with people who I want to help out with regard to charity. But it is not my job to pay for your healthcare, because if I'm paying for your healthcare, that creates a perverse incentive system where you can go make a bunch of decisions that are not great for your health, knowing somebody else is going to pick up the tab and access health services at a faster pace. All of that said, the effectiveness of these healthcare systems abroad, there are a bunch of different types of systems. Everybody sort of thinks that there are two systems. There's the free market system, and then there's the nationalized system. This is not true. There are a bunch of different types of system. The Swiss system is a lot more privatized than, for example, the Nordic system. The Swiss system works great, and the Nordic system works pretty well too. There are differences between how they work. They both work, but part of the reason they both work is because they had functioning healthcare systems before they actually had a nationalized healthcare system in Sweden, for example, or in Norway. And the reason for that is, again, because lifestyle differences and cultural differences in these places, these are not the same places as the United States. You have to take these things into account. You can't just take something that works in Denmark and assume it's going to work in the United States. That's idiotic. That's not how policy actually operates. Anyway, Bernie Sanders says he wants Medicare for all. So there's a new study out today from the Mercatus Center at George Mason University in Virginia. Now, the left is saying that this study is nonsense. It's nonsense. How do we know that it's nonsense? We know that it's nonsense because, after all, it was funded by the Koch brothers. Well, how about this? There's another study from the left-wing Urban Institute. They estimated the cost of Medicare for all. Here's what they came up with. $32 trillion over the next 10 years. $32 trillion. That is twice the annual GDP of the United States. It is double the annual federal budget every single year. Okay, it's another $4 trillion of federal budget every year. And there's a study from this Mercatus Center, and they say it'll cost $32.6 trillion over 10 years. According to Bloomberg, Bernie Sanders' plan builds on Medicare. All U.S. residents would be covered with no copays and deductibles for medical services. The insurance industry would be relegated to a minor role. Charles Blauhaus is the study's author. He was a senior economic advisor to former President Bush and a public trustee of Social Security and Medicare during the Obama administration. So this is not a partisan hack. He says enacting something like Medicare for all would be a transformative change in the size of the federal government. So $32.6 trillion. How much money is $32.6 trillion? Tiana Lowe over on Twitter, she says that is nearly twice our annual GDP. It's 54 times our annual defense spending. It's over 8 times our annual federal budget. It's 281 times the private sector's annual medical R&D investment. It is 867 times the federal government's annual medical R&D investment. And by the way, Medicaid covers 1 in 3 Californians and nearly 40% of LA residents. And since the ACA expansion, Medi-Cal providers went from barely breaking even to making $5.4 billion in profits from 2014 to 2016. Okay, so this is ridiculous. Okay, by the way, the statistics I'm citing about, it's 867 times the federal government's annual medical R&D investment, right? We are talking about over 10 years, but still, it is twice our annual GDP, $32.6 trillion. It's an enormous blowout in spending. Now, Bernie Sanders doesn't have any actual argument with these statistics. He just doesn't like that the Koch brothers funded this particular study. But again, the Urban Institute says it'll cost $32 trillion as well. It turns out that covering people's health care endlessly means that you're going to spend endless amounts of money. Now, Dan McLaughlin over at National Review, he has a framework for understanding healthcare, and here's what he says. He says, basically, you can have 3 things in healthcare. You can have affordability, you can have universality, you can have quality. You can only have 2 of those 3 things. You cannot have all 3. Again, affordability, universality, quality. It can either be cheap, or it can be universal, everybody can have it, or it can be good. So it can be good and it can be affordable, but not everybody's going to have it, right? It's a free market system. You can have universal and cheap, but then it's going to be kind of crappy. You can have universal and good, but then it's going to be really expensive, right? So you can only have 2 of these particular 3 things. Bernie Sanders says you can have all 3 because he is lying to you. I love this. Bernie Sanders' office, they say that this estimate is bad, but their office has not done a cost analysis. Wait, you mean a lazy socialist who didn't bother doing his homework? I can't believe it. That's crazy. Bernie Sanders' staff did find an error in an initial version of the Mercatus report, which counted a long-term care program that was in the 2016 proposal, but not the current one, which means it will merely cost $29.6 trillion as opposed to $32.6 trillion. Oh, well, that fixes everything. And by the way, you could remove every dollar from every rich person in the United States. It would not pay for this for more than a year. Okay, so this idea that you're going to somehow fund all of this is just insane. The study estimated that doubling all federal, individual, and corporate income taxes would not fully cover the additional costs. So all of this sounds great. All of this sounds nice. How are you going to pay for it? The answer is you ain't. You ain't. Because Democrats have no interest in paying for this stuff. If you actually want to help cut healthcare costs, by the way, in the United States, there is a way to do it. What you actually have to do is ease regulation, particularly when it comes to all of the administrative paperwork. Dealing with all the regulation is what doctors do most of the time. You may have heard, my wife is a doctor. Okay, being a doctor, that means she has to deal with paperwork on a near constant basis. And when you own your own office, you have to deal with Medicare and Medicaid. Many doctors have stopped working with the government because they don't want to deal with all of the regulations and all the paperwork. The New York Times has a piece out just a couple of weeks ago saying that it only takes a glance at a hospital bill or at the myriad choices you may have for healthcare coverage to get a sense of the bewildering complexity of healthcare financing in the United States. The complexity doesn't just exact a cognitive cost, it comes with administrative costs. In 1999, the New England Journal of Medicine, which is the premier journal of medicine in the United States, they estimated that about 30% of all American healthcare expenditures were the result of administration. In other words, dealing with insurance companies, working with the government, trying to deal with regulation, all that stuff is expensive. And you know who gets charged for it? You do. And your insurance company does. There are ways to cut down on that, but that means deregulation, which is precisely the opposite of what the left actually wants to do. It also turns out, by the way, that in nationalized healthcare systems, there's a lot of paperwork as well. This idea that it solves everything to be nationalized is just not true either. So this is what's so ridiculous about this. The Democrats come forward with their proposals for 2018. This is where Trump really should be hitting them. What Trump should be saying is, you can't allow these people to be in charge, because if you put these people in charge, it's going to be a disaster. Okay, their policy proposals are insane. Another policy proposal it just shows how asinine the left's take on economics is. Okay, Kamala Harris tweeted this out. Okay, she tweeted out, under the Rent Relief Act, anyone who spends more than 30% of their income on rent would be eligible for a federal tax credit. What would you do with that extra money in your pocket? I want to, let's do some basic econ here. Under the Rent Relief Act, anyone who spends more than 30% of their income on rent would be eligible for a federal tax credit. Where do you think that money's going to go? The answer is to the raised rent. Okay, you'll spend more money on rent. Because if I just give you money back because you spent a lot on rent, what do you think that your landlord is going to do? He's going to raise your rent because there's now increased demand in the housing market. There are people who want to get into the housing market and spend more in the housing market, and they're going to offer the landlord more. You're just going to take that money, and you're now going to spend it on the rent. Democrats don't understand basic economics, so they make proposals that sound like free money, but actually are just inflating the cost of the actual product itself. No Democrat should not be in charge.
Okay, I'm really sorry I had to put you through all that. Torture is essentially what that was. Just a spewing of complete bullshit nonsense. So I watched the video. I essentially wrote down a bunch of points of a complete bullshit, all the bullshit that he spewed here. So in the beginning, he says that Bernie Sanders is a nut job, which is hilarious because I can't imagine someone calling, Bernie Sanders a nut job. Like, what's a nut job about? And wanting health care for everyone in the United States. Whoa, dude. Oh my God. So he starts out because the clear first point of anybody who's advocating for a single payer system in the United States is, this is not a situation in which it's unprecedented worldwide. Like, holy smokes, single payer healthcare? This is basically communism V2. This is Stalin come back to life. This is Mao 2.0, fucking Pol Pot V2. Holy shit. No. This is something where we're actually trailing all the other nations in the world. We are trailing all of the European nations. We're trailing. There are an insane amount of nations that have a single payer system. Now, the thing about single payer healthcare is it's not one set system. Every country has a different system. They all deviate in some way, shape, or form, and that's getting into the nuance and details of it, and I'll touch on that as we go through this. But every other major modern nation has a single payer healthcare system. That is a fact. Every other modern developed nation has one form of single payer healthcare or another. That is a fact. And some of them have granted healthcare as a right. Now, I actually don't think that's a good idea because I don't see the purpose of it personally. I think it'd just be a waste of time. But Bernie Sanders has made the claim that all of the modern industrialized nations grant healthcare as a right. That's actually false. Only some of the European countries do that. What the fact is that all of the modern industrialized nations actually have one form of single-payer healthcare or another. That's the actual fact. So he starts out with all of this different fear-mongering tactics about Europe. Somehow, the Conservative Party there have been actually cutting funds, and somehow he blames that on the system. How are you going to blame the healthcare system for Tory conservative fucks like you cutting funds? That doesn't make any logical sense. That's like you deliberately sabotaging something by removing funds and be like, oh, look at what's happening, man. Like, no shit, Sherlock. It's because conservative dickbags like you want the funding to be removed, want the funding to be cut. And these European fear-mongering tactics just don't make any sense. They're not merited. They don't have any merit to them. They don't have any evidence, and that's why he didn't provide any statistics. He didn't provide any numbers. He didn't provide any of the, oh, look at the U.S., it's so low-ranked in every fucking healthcare category possible. Now, here's the first flaw. He claims that Bernie Sanders wants a nationalized healthcare service. Now, this is the guy who's a lawyer, right? He's a lawyer. Or at least he has a law degree, which is an insane thing to be able to get. That is very difficult to get, first of all. He's supposed to be the facts over feelings guy. He's supposed to be the next William F. Buckley, but the dickbag doesn't know that Bernie Sanders doesn't want a nationalized healthcare service. That's not a nationalized healthcare service. What you're thinking of is the NHS in the UK, which is actually a nationalized healthcare service. This is different. First of all, what the UK does, and this is where all the intricacies come with healthcare, and you can't be just surface level single payer free market. You have to know the different intricacies of all of the different systems in the different countries. So in the UK, they have a different system than they do in Canada. In the UK, they actually run their own hospitals. The NHS, and this is the country that Sargon lives in, by the way. This is the country where they actually run the hospitals. They have the hospitals. They run those. The government runs those. They are the people who run those hospitals. And so what you're talking about is they have a nationalized healthcare service. Canada, on the other hand, which is the most similar system to what Bernie Sanders has proposed, that's not a nationalized healthcare system. What that is you're giving a Medicare card to everyone so that they can go into whoever accepts that insurance. So, for example, in Canada, they have a similar system to what Bernie Sanders is proposing, but they actually have 83% of their healthcare is actually privately delivered. So what does that mean? So that means Canada, their government gives insurance to these people, and then they go to these private doctors and health insurance and shit, and they give them the insurance, and then that's how they actually get their healthcare. And so 83% of Canada's healthcare is actually privately delivered. They also, on top of that, by the way, the government negotiates with the pharmaceutical companies to get pharmaceutical drugs so much cheaper. That's why they're so much cheaper than they are in the United States. That's why they're so much fucking cheaper there. Now, so that's the thing. He doesn't want a nationalized healthcare service. He wants to give everyone a Medicare card. He doesn't want to have a national healthcare service. That's not what he wants. Now he goes on with the talking point about the population, but the UK has a population of 65.64 million. That's a lot of fucking people. And I can understand the difference between a country with 8 million people and a country with 350, but the conceptual difference between a country with 65 million and 350 million is really non-existent, because you pass the threshold of being a big enough country to make a comparison. The fact that we have 350 million people doesn't make a difference, because everything is proportional. It's going to be the same just as the UK has, 65 million people, and they're just fine. Now, there's also the talking point of all these countries being homogenous, and that's why they can do it. Well, hold on a second. First of all, the UK is becoming less and less homogenous, and that's something that a lot of these people complain about in the first place. But Canada is not homogenous. They have plenty of diversity in Canada, and their shit is running just fine, and is running more efficiently than our service than our system is. But I want to say, and I want to question this, what does it have to do with what their race is? What are you trying to say? What does it matter if the country has black people, white people, yellow people, green people, orange people? What difference does that make with the healthcare system? That doesn't make shit for a difference. It doesn't make a fucking difference, because it doesn't matter. This is a bullshit talking point that doesn't mean jack shit, because it doesn't apply to anything, and it doesn't make any sense. It doesn't make any sense. And he says that people are going to just start hurting themselves because, oh, now it's covered. That's not what they're going to do. That's one of the dumbest talking points I've ever heard. He's really a big time dick of not wanting to ensure that other people have healthcare. As long as he and his family have healthcare, he's just fine. I think healthcare, the way funding for healthcare should be, is just the same way that we have funding for police and fire departments and stuff, because we need to come together. This is something that's life and death, just like it is when there's a fire and there's danger and shit like that. So we should publicly fund it. I totally think that's the way that we should do it. So what I don't understand is he starts to compare the cost over 10 years with annual numbers. Why? Why would you do that? I don't understand. You're saying that it's twice the annual cost. No shit, you stupid fuck. It's over 10 years, you fucking liar. You piece of shit. I don't understand why he's doing that. It doesn't make any sense, and it really fucking pissed me off a lot. And then he pivots to, he makes this talking point a bunch. And this is some like Dick Cheney stuff. I seen some interview with Dick Cheney where he'll be asked a question, and when asked to explain his answer, he just restates the claim. So Ben Shapiro goes, oh yeah, you can only have 2 of 3 things. I think it was accessibility, affordability, and quality. You can only have 2 of the 3. You can't have all of them. And he repeats that shit 2 or 3 times. Like, are you going to explain why you can only have 2 of them? Why? What is the rationale for only being able to have 2 of those? Why can you only have 2 or 3? And then he just goes on to restate his claim. Dude, that's not how you formulate an argument. You don't formulate an argument by proposing your claim and then going on to restate your fucking claim over and over again. That doesn't make any fucking sense, man. That doesn't make any sense. And then he calls Bernie Sanders a socialist. Bernie Sanders isn't a socialist. He's a social democrat. Bernie Sanders does not want to, have fucking workers owning industry. That's not what Bernie Sanders wants. He's not a socialist. He's a run-of-the-mill social democrat that runs on a Nordic system. He's not a socialist. Stop trying to use the fear-mongering tactic, you piece of fucking garbage. You lying fucking dick asshole. That's what you are. And so he goes on and says, well, the Bernie camp corrected him by 3 trillion. Oh my God, it's only going to go down to 29 trillion. Dude, do you know how good that is? That means that essentially the savings is actually 5 trillion over 10 years. That's fucking awesome. We get to cover every single human being in the country, and on top of that, we get to save $5 trillion over 10 years. If you're a fiscal conservative, tell me how the fuck you're in opposition to that. Go ahead. And then, of course, my wife is a doctor. The ultimate meme returns. My wife is a doctor. That doesn't mean shit. We already know your preconceived notions. It's irrelevant what occupation your wife has. It does not matter. And then he talks about doctors. There's a lot of doctors who actually, they go out of their way to take Medicare and Medicaid patients because they actually want to help poor people while still making money. It's not like they're going to go broke doing that. They're going to continue to do it. Maybe not make as much, but they're not going to go broke doing it. And so, again, I want to reiterate that this saves $2 trillion over 10 years. And by what Ben Shapiro mentioned about how the Bernie Sanders camp told him about how we took a program out of this plan and that's going to save even like $3 trillion more, that would bring it up to $5 trillion savings. And then this really pissed me off because this dickbag had the gall to talk about administrative costs and blaming the government for that. When these administrative costs are massively from private insurance companies and not from Medicare. Medicare has about a 2% administrative cost percentage, while private insurance companies have it about, I think it was like 20%. That's a huge, huge, huge difference. Absolutely huge difference. And these come because the private insurance companies are trying to compete to get clients. So what is that? Why would Medicare need to do that? They're not going to do that because there's no need to make advertising to spend all this fucking money. It doesn't make sense. So, and just to build off that, we have some data from 2010 and 2011 that says that percentage-wise, the United States is the highest in administrative cost, with over 25%. Holy fuck, a quarter of the healthcare costs are administrative. That is disgusting. And so if we switch over to Medicare for all, that's going to get slashed down to like 2%. And well, I wonder what country was at the lower end of the administrative cost percentage-wise. Oh, look, it's Canada, a country with a similar program that Bernie Sanders wants to implement. So the problem with the administrative cost is because of private health insurance companies, not because of Medicare. That is so stupid. And this whole thing was just regurgitating this propaganda that relies upon the foundation of lies, misinformation, and massive falsehoods rather than actual pieces of evidence and facts. And again, man, I hope you guys survived watching that clip because, man, it was really, really shitty. But this was really bad, really fucking bad. I have to say this is probably the worst substantive-wise video I've ever seen because he never mentioned the savings once. And obviously it's because it doesn't match his ideology.